Infertility and tubal diverticulum. Tubal diverticulum is a congenital anomaly,
And in some cases, it may result from poor surgical techniques during an ectopic pregnancy, leading to a weak segment.
Its true anatomical structure involves an enlargement in the fallopian tube,
where the tissue becomes loose or thin, forming a sac-like cavity. The passage of the egg through this area becomes difficult, resulting in fertilization challenges and potential ectopic pregnancies.
It can also cause delayed entry into the uterine cavity.
While others may have their period for 2 days, she may experience a delay of 4 to 5 days. By then, the endometrium has passed the window of implantation, resulting in infertility.
Diagnosing this condition is also challenging in clinical practice, as some cases are congenital, leading to potential misdiagnosis. Labeling it as unexplained infertility often leads to suggestions of in vitro fertilization, IVF, which not only incurs additional costs but also carries the risk of emotional and financial burdens. After all, the success rate of IVF is relatively low. Therefore, significant efforts should be made in the diagnosis of unexplained infertility. Seeking experienced doctors and hospitals for accurate assessments.
If dynamic digital hysterosalpingography can be performed, it is easier to detect the condition as the fallopian tube suddenly widens,
and a large amount of contrast medium accumulates for visualization. However, the definitive diagnosis ultimately requires hysteroscopy and laparoscopy combined, which provides 100% confirmation.
For patients with this type of infertility or recurrent ectopic pregnancies, the treatment is relatively straightforward.
We can perform excision and suturing of the tubal diverticulum under 3D laparoscopy, using extremely fine sutures for optimal reconstruction.
Additionally, a tubal stent should be placed inside the fallopian tube to prevent adhesions and blockage. The diameter of the fallopian tube is very small, with certain areas measuring only about 1 millimeter. Without sophisticated equipment and advanced surgical skills,
repairing it becomes challenging.
Beijing Antai Hospital possesses tubal stents and 3D laparoscopy equipment, allowing us to confidently offer a treatment policy of full refund if no pregnancy occurs within 2 years or if another ectopic pregnancy occurs.
Guaranteed medical services are the golden signature of Beijing Antai Hospital.
The outcome of infertility is straightforward: pregnancy, without the need for third-party validation. The success or failure can be determined by the parties involved, allowing for a contractual treatment approach with a full refund policy for unachieved goals.